OCT and most recently OCT have revolutionized the way that we practice. Since the early 2000s, when OCT entered our clinic, our understanding of retinal diseases has evolved exponentially. We are now evaluating the retina in three dimensions, visualizing which layers are affected and understanding how the retina responds to the treatment. OCT is a quick, non-invasive and reproducible imaging tool for macular lesions and has become an essential part of retinal practice. This is an optical analog of ultrasound imaging that uses low coherence interferometry to produce cross-sectional images of the retina. This is easy to use, reproducible, safe, non-invasive, works similar to ultrasound, uses light waves instead of the sound waves. The use of the light waves allow for higher resolution and evaluation of the tissue pathology at the cellular level. This has become critical tool in the diagnosis and to monitor the disease response to the treatment, helpful in the interpretation of the pathologies in all the layers of the retina. OCT technology has continuously evolved and expanded from its inception as time domain OCT to spectral domain OCT and Schwarzschild OCT. As we can see in this graph, 1996 time domain OCT machine was made by Zeiss. In 2006, commercial spectrum domain OCT appeared in the market, and it is 2012 when Schwarzschild OCT was available, and now in 2014 comes the OCT angiography. From time domain to spectral domain to Schwarzschild, the acquisition scanning speed has improved a lot. From 400 A scans from in time domain to 70,000 scans in spectral domain, it has improved to approximately 1 lakh to 4 lakh scans in Schwarzschild. Dramatic improvement. This is a picture taken by time domain OCT machine. This is spectral domain machine pictures, and this is taken by Schwarzschild. Resolution of OCT images are very high. Approaches tissue histopathology examination 5 to 10 micron. This is based on Michelson interferometry. To understand and to interpret OCT, one has to know the layers of retina. This is very important. Without knowing the layers of the retina, you won't be able to interpret the OCT findings. This is a retina. This is inside vitreous side. This is outside sclera and choroid. Retina contains basically three tissues. From inside vitreous side is ganglion cell. Second comes the bipolar cell, and third is rods and cones. Ganglion cells and bipolar cells are connected by inner plexiform layer, and bipolar cells and rods and cones are connected by outer plexiform layer. So one has to remember in one's memory, first is the ganglion cell, then the bipolar cell, then the rods and cones. So when we start the different layers of the retina from inside, first is the internal limiting membrane, second comes the nerve fiber layer, third comes the ganglion cell layer, fourth comes the inner plexiform layer, fifth comes the bipolar cell's nucleus, and sixth comes the outer plexiform layer, seventh comes the outer nuclear layer, nucleus of the rods and cones, and eighth comes the external limiting membrane, ninth inner segment of the rods and cones, and 10th is the outer segment of the rods and cones, and next comes the RPE complex. So one can see all the layers of retina as seen in histopathology examination, also in OCT picture. Just see, all the layers are visible in a OCT picture. As we move from inside outside, first is the internal limiting membrane, second is the neurofiber layer, third is the ganglion layer, fourth is the inner plexiform layer, fifth is the inner nuclear layer, sixth is the outer plexiform, seventh is the outer nuclear layer, and 8th is the external limiting membrane, 9th is the ellipsoid zone, 10th is the interdigitation zone, and 11th is the RPE, and 12th is the choroid. So all the layers are very nicely visible. So to interpret, diagnose various pathology in OCT, one has to know all the layers of the retina. And to know the findings on a OCTA, OCT angiography, one has to know the various plexus present in the different layers of the retina. Outer retina is avascular at the level of rods and cones. Inner retina between neurofiber layer and the ganglion sand and the inner nuclear layer, these two layers are vascularized. There are two plexus, superficial plexus and one is deep plexus. Superficial plexus is at the level of ganglion sand. Deep plexus is level of the inner nuclear layer. So one has to remember retina, ganglion cells, superficial vascular plexus, inner nuclear layer, deep vascular plexus, outer to outer plexiform layer retina is avascular. So on OCTA we see 4 slabs on examination. Superficial retina at the level of ganglion, we see picture just like FA picture. And the slab at the level of inner nuclear layer, we see lot of vessels because of deep vascular plexus. And at the level of outer retina, at the level of rods and cones, this is avascular. Any vascular tissue present in this area is pathological. At the choroid, we see the choriocapillaries. One has to know the 4 slabs at different layers of the retina to diagnose any pathology on OCTA. Superficial slab, deep slab, choroid slab. This is choriocapillary slab. This is choroid slab. So again, superficial slab, deep vascular slab. This is outer retina, avascular. This is choriocapillaries. So OCTA, based on the ability to image flow in the retina, it is able to differentiate abnormal presence of flow, absence of flow, abnormality in the vessel geometry. So abnormal presence of flow, neovascularization, anomalous vessel geometry, aneurysms, and absence of flow, ischemia, CNP areas. These can be picked up on OCTA. Optical coherence tomography protocols, scanning protocols. They are 3D scan, radius scan and raster scan. This is 3D scan, radius scan, raster scan. 3D scan is used to find a lot of data. It generates a 3D view of the image which enables the implementation of advanced complex analysis. Example, C-scan, topography maps and cyst volume, and gives a holistic view of the macula. Raster scan to see the high definition intraretinal layers. Radius scan to know the pathology in relation to the macula. OCT is very helpful in diagnosis diabetic retinopathy macular edema. This is the investigation of choice on which treatment is based. If the macular edema involves the center, then anti-VEGF are given. If it doesn't involve the center, then intravitreal VEGF usually withheld. Different types of macular edema are seen on OCT. 5 types. One is diffuse retinal thickening, second is cystoid macular edema, and third is serous retinal detachment, and fourth is epiretinal membrane leading to macular edema, and fifth is the VTRD. This is a case of CRS. You can see very nicely see neurosensory retinal detachment with pigment epithelial detachment. So With OCT, one is able to pick up the CSR findings very clearly. In case of CRVO, one can see the macular edema. So this is a non-ischemic. Macular edema is not significant, but this is ischemia. So we can see huge macular edema. Age-related macular degeneration. OCT is very helpful in diagnosing dry and wet both. In drusen, we see the pigment at the level of RPE cells. OCT drusen are seen as discrete areas of RPE elevation because of deposition of drusen at the level of Bruch's membrane. Geographical atrophy occurs because of the loss of the RP cells. It leads to increased penetration of light into the choroid and there is thinning of the retinal layers. Wet RMD, we see intraretinal, subretinal fluid, pigment epithelial detachments, and choroidal neovascular membrane. OCT is the investigation of choice which tells us whether the CNVM is below RP, above RP, or it starts from the retina. Type 1 is below RP, type 2 is above RP, type 3 starts from the retina. This is a case of classic CNVM in which CNVM is above the RPE layer. So OCT is probably the most widely used imaging modality in ophthalmology. It provides micron scale depth resolution, used for diagnosis, follow-up, assessment or treatment efficacy. It also gives us various biomarkers. OCTA is an extension of OCT that uses motion contrast to visualize blood vessels down to the capillary level. So, in nutshell, during past 2.5 decades, OCT has evolved to become an essential tool in ophthalmology. This has clearly revolutionized the assessment of patients with retinal disorders. This has changed the approach of ophthalmologists in their daily practice. We have come a long way in treating our patients with the help of OCT. Thank you.